Good morning. Hi, everyone. I would like to thank your participation and viewing our podcast. This is the second annual Peds GI Connect conference. And today I have the pleasure of three of my colleagues in nutrition, and we're going to each talk about our interest in nutrition and how we got to where we are and how we can encourage others to pursue this. My name is Dr. Valeria Cohran. I'm the medical director for intestinal rehab and transplant at the Ann and Robert H. Lurie Children's Hospital in Chicago. My counterpart is...
I'm Praveen Goday. We're all pediatric gastroenterologists here. I'm the director of nutrition and feeding programs at Nationwide Children's Hospital in Columbus, Ohio. I'm also a professor at The Ohio State University.
Good morning, Val, Praveen, and Maria, and everyone here. My name is Chris Duggan. I'm a professor of pediatrics at Harvard Medical School, where I direct the Division of Nutrition. I'm also the director of the Center for Nutrition at Boston Children's Hospital.
And I'm last, but best. Just kidding. I'm Maria Mascarenhas from the Children's Hospital of Philadelphia. I'm a professor of pediatrics at the University of Pennsylvania School of Medicine, and I run the clinical nutrition department at CHOP. I'm the section chief at Children's Hospital Philadelphia Division of GI.
Well, thanks everyone for joining. I'd like to start off perhaps asking what really spurred you on or gave you this interest to pursue a career in nutrition? We'll start off with Praveen.
Well, mine's not a direct route to nutrition. I was a little lost after my fellowship, and nutrition was thrust upon me. I was asked to run a nutrition program, and I said I didn't know anything about it, but I was told I could do it. And that's what I've been doing for a long time. So I think it's important to think about whether it's something you want to do. Now you can get additional training in nutrition in a variety of places. It was less available when I was a fellow, but you may still be able to pursue a career in nutrition without actually doing an extra fellowship. Chris?
A life-changing experience happened to me when I was a second-year medical student, actually. So faculty at Johns Hopkins University at that time, Keith West and Al Summer, were making really important observations about the importance of vitamin A in child survival. So they took me for the summer to Central Africa. I worked on a study with them in Zambia. And it really just had a profound impact on my life and my career, where I really saw firsthand the importance of the interaction between nutritional status and outcomes, health outcomes, including mortality, diarrheal disease, and pneumonia. And at the time, this is back in the 1980s, of course, everyone who went into what we now call global health were infectious disease specialists, right? That's essentially what people did. But then my soon-to-be wife at the time also was interested in infectious diseases. And we had a really important decision to make, which was, could both of us enter the least well-paid job in pediatrics? And so I really took the focus of nutrition and pursued gastroenterology training at that time.
I think my path is not as inspiring as yours. And I would say serendipity, because I was probably the first GI fellow that did a nutrition rotation in CHOP. And then when they wanted someone to take over the nutrition support service, they came to me and said, you need to do this. So as Praveen said, just you rise to the occasion, teach yourself, and then you grow. And I think that's what's really nice about nutrition is there's so many opportunities that you can grow. And I'm still growing now because now I'm entering the field of culinary medicine. So it's really that in nutrition, you can go the research route and do really amazing work like Chris. You can go the clinical route and make big impact like Praveen or you, Val. But you can also explore things and move the science and help and the practical stuff, and then bring this, try to teach people how to integrate nutrition into more the fabric of pediatric GI care. So I think nutrition is a huge scope.
When I think about why I am interested in this area, I was I got interested in medical school to do GI, to specifically hepatology, and I matched at Cincinnati Children's, where the great Jim Hybe, Mike Farrow were, and they had a very large intestinal rehabilitation program at that time. And so as a resident, I saw these patients who over time were tapered from their TPN. From over time, you're seeing them and they're doing well. And so seeing these patients and seeing what it took to take care of them and the close interactions with the families, looking at how much their stool output was, measuring their electrolytes, it just really excited me to do that. And it was no choice. I had no option. I wanted to do intestinal rehabilitation. Sam Kokoschis came from Pittsburgh and started the transplant program. And from there, my career had been sealed. So these are patients that I take care of pre and post transplants. I think the close relationships with the families are very important. I think the multidisciplinary aspect of it, when you're working with the dietitian, the pharmacist, the social worker, these patients have a lot of needs, and they may have difficulties coming to clinic, being able to miss work, needing paperwork filled out, whether it's FMLA or help with their electrical bills or whatever it is. And so I think just the intensity of the care these patients needs, the collaboration you have with the families and the other team members just really excited me. And it's why I've continued to do this work today. One of the other questions I would like to ask is, as I see trainees coming out, a lot of the trainees are interested in endoscopy. They're interested in inflammatory bowel disease. I don't see them as interested in the nutrition aspect of pediatric GI. And so, if you guys can perhaps let's talk about some reasons that this is really a field that they should consider entering.
Yes, absolutely. Well, the four of us have made this the focus of our lives in different ways. I think Val has stuck to her intestinal rehab roots and has not given it up, but the others have branched out and done other things. But I think, well, clearly nutrition affects everybody, whether you are well or ill. It is really, really important. And for our patients, it is an important part of their disease and their therapy. And so I think focusing on nutrition is really important, and people don't realize how important it is in the individual child's care. The other thing that the other three of us have done is branched out into what is under the purview of a Peds GI person, which is intestinal rehab. So intestinal rehab nutrition is what pediatric gastroenterologists are supposed to focus on. That is absolute garbage. So we should really branch out. We are the right people to be experts in pediatric nutrition and carry it to all corners of pediatrics. Well, Chris has done it to other parts of the world, and I feel like I've taken it to various parts of the hospital. So you have to decide where you want to take that nutrition to and not keep it within the pediatric GI umbrella alone. Like there's the PICU, there's the hospital, there's the NICU, there's outpatients, there's obesity, there's a million things. And then, of course, you can go to Tanzania or other parts of the world, right? So with that, I'll hand it over to you, Chris.
No, those are great points, Praveen. And I guess, Val, I'd have two thoughts about your observations about the relative lower amount of interest in nutrition as a specialty within the fellowship. I would say, for one thing, there's a great deal of interest in nutrition within our undergraduate medical schools. We have a fourth-year elective at Harvard Medical School called an advanced integrated science course called Nutrition, Metabolism, and Lifestyle Medicine. And the degree of interest that our students have at this point, realizing that during their clinical training, they just don't get enough nutrition, is substantial. So I think we really need to capitalize on that interest in perhaps folks who are not yet fellows, but are coming up through the ranks. I'd say that. I also think that it's important to realize that most gastroenterology fellows are interested in procedures. And so I think one of the ways that nutrition has perhaps not advanced as much is the lack of actually hands-on procedures. So one thing that we've tried to do over the past few years at Boston Children's Hospital is use the tools of the trade, if we will. And I know they do that at CHOP too, which is using indirect calorimetry as a way to actually measure someone's resting energy expenditure and titrate the amount of nutrition they provide. We look at specific populations, as Praveen mentioned, our bone marrow transplant unit, for instance. For years, we would give them 140, 150% of predicted resting energy expenditure until we observed what their energy requirements were, and they're actually much lower over the course of transplant. So there's a lot to learn about nutrition, and we just need to encourage our fellows to seek those answers.
So I don't think you can do pediatric GI without knowing nutrition. And you can't do nutrition without knowing pediatric GI. So the two are really woven. And I like what Praveen said is that it's not just in pediatric, you can really take nutrition outside the pediatric GI world. And I think any institution needs someone with expertise, needs a physician with expertise in nutrition. Because there are a lot of dietitians and we know them and they do wonderful jobs, but you need that physician looking into that physician lens to help direct nutrition care institutions. And I think for four of us, we all do that at our institutions, nutrition committee, formulary, etc.
Yeah.
Right.
So it really makes sense for any pediatric GI group to have one person whose passion and interest is nutrition. So you guide not just the pediatric GI division, but also the hospital. And if you have more than one, that's even better, because I think all of us have done different things. But I really do feel very strongly that pediatric nutrition should be stressed during a pediatric GI fellowship, because if the only people who know pediatric nutrition are dietitians, that's not good. You need to have a physician who also has this expertise. Yeah.
One of the things you made a comment about the dietitians. And so we're all at very large academic centers. We have a lot of dietitians. And what I tend to find for the residents and the fellows also, they depend so heavily on the dietitian that they don't ask the question, what is this formula? Why are you using this formula versus that formula? And I frequently try to ask one of my questions. So the dietitians have been kidnapped. Which formula are we using today? We don't have ransom money. Right. What formula are we going to use today? Yeah. Because I do think they're wonderful to work with. I think they're great. But I do think as the physician also, we need to have an understanding, as you emphasize, of which formula, what's the differences? And we have so many different formulas out there that I just think that for the trainees to try to also kind of incorporate that and not just be a little bit more passive because you have a dietitian there who's, the dietitian said this. Well, why did she say this? And so trying to work with that, I think also is helpful.
In Wisconsin, we found that the fellows were highly dependent on the dietitians, and we kind of removed the dietitian from the fellows clinic and made her a consultant. And the fellow had to present to the dietitian and figure it out for himself or herself. This really led to improvements because all four of us are from major academic centers. We have tons of dietitians, but when they go out, they don't have that much support. This doesn't mean that you shouldn't have dietitian support. I think it's a crime to run Peds GI services without dietitian support, but I think we need to also co-direct nutrition with our dietitians. It's vital.
I think that those are excellent points. And even more fundamentally, I always tell potential GI fellows that the beauty of gastroenterology, of course, is that it's the basics of pediatrics, right? The first thing in your problem note is fluid, electrolytes, nutrition. And indeed, I would even say, Val, that not only are our trainees sometimes limited in their ability to choose appropriate formulas, but even the first two parts, fluid and electrolytes, are really a component of their training that's often missing. And we see this often when we refer into the emergency department patients with our congenital enteropathies, and the appreciation for what kind of fluid requirements these patients have is often lost. And maybe that's a function of training, maybe it's a function of the electronic medical record and cut and paste errors, but patients with very severe, very high fluid requirements will come into the emergency department and they'll be placed on maintenance IV fluid, which is roughly half of what their total needs are because of their losses. And I think it's a real issue.
Just to add to what you said is, I remember way back when I was an intern, we had to present nutritional status, right? When we presented cases, no one does anymore, but we know how important nutritional status is on outcome.
Yeah.
You know, whether it's malnutrition or IBD or whatever disease you have, nutritional status is key. And I think we need to bring nutrition back into the care of every pediatric patient.
We've also become a little static. It seems like the bedside nutrition has not progressed. And I wonder if when Chris brought up the idea of procedures and indirect calorimetry, should we be looking to better body composition tools which can be used at the bedside to direct nutrition? Because we have very crude methods of how children are assimilating nutrients and growing. And so these can be exciting times. We need fresh blood to think about this differently. And there are lots of things to do in nutrition. So if you are contemplating a nutrition career, you should reach out to one or all of us, and we can definitely talk to you.
I always make the point when we're treating a patient with short bowel syndrome with a GLP-2 agonist, we're using a 21st century medication, but the efficacy measures are based on 16th century technology, which is weight and counting stools.
Yes, absolutely.
Excellent point.
There's a lot of scope for research, nutrition research in pediatric patients. So I think if someone's leading towards to a research career, I think there's a lot of opportunity. There's not enough nutrition research going on in pediatric patients at this point.
The other important thing is you can liaise or collaborate with lots of people and lots of disease states to be the nutrition expert for that disease. And if you are in a hospital or a hospital system that's very good at X, whatever that X is, studying the nutrition status of that particular disease may be a good way to get yourself moving forward, even if you're not in one of the largest academic centers in the world. Something else to think about.
Or from a patient safety standpoint, the use of parenteral nutrition is obviously a very high risk intervention. And so getting the attention of the hospital leadership about how we can provide this expensive and risky therapy in a better way is a really important career choice.
The other important thing is advocacy. We are talking about disease states here, but then there are many more children who are otherwise healthy and have other nutrition needs, normal nutrition needs, or hunger and issues like that. So if advocacy is your passion, that's another way to think about life and move forward as well, both within this country and outside.
And what about nutrition education?
Right. Right.
I think you're very lucky at Harvard. You have this nice course, but I don't think the average medical student gets a lot of nutrition education. Pediatric resident doesn't get much. And I'm hoping that in pediatric GI fellowships, there's a strong nutrition component, but I think nutrition education is another area where there's a lot of scope.
Yeah, I think the average medical student gets about 12 hours over 4 years of nutrition education, and at least 2/3 of that is biochemistry, which is crucial, but there's more to it than that.
Right. I think once you're a pediatrician and a pediatric gastroenterologist, you can focus on pediatric nutrition, which is slightly condensed as opposed to all of nutrition. And then think about which avenues within that you want to pursue. Gather as much expertise as you can. Luckily, nutrition can be self-taught. You really need a lot of experience, but teaching yourself, talking to other people, getting mentors, gaining more experience, that's the way to do it, I think. If you can do a fellowship, great. But even otherwise, I think you should consider a career in nutrition.
I think NASPGHAN has funding or gets funding from outside sources to help have a nutrition fellow each year. I think that there are multiple fellowships throughout the country, CHOP, Boston. I'm not sure about Denver, Cincinnati, LA. So there are definitely programs out there that if you're interested in pursuing this to a further degree, that you have the opportunity to do so.
So one area, you mentioned Naspegan, Val, which is great. I think one area that I think Naspegan would really be great if they showed some effort in would be the advocacy for pediatric nutrition board certification. And I think the development of new medications for both obesity and short bowel syndrome are a perfect opportunity for them to advocate for this, because I think there's a real need for people to be certified in what we realize is almost a separate area of expertise.
Yeah. And one more thing I would just add is there aren't that many pediatric leaders. So if you're someone who wants to be a leader, this is a field where nutrition, pediatric nutrition leadership, it's open. So you can go down that path. Wouldn't you agree, Chris?
I agree, for sure.
Finally, not facetiously, if you're looking for job security, nutrition is a great field. There is a dearth of people who are doing nutrition, and if you do it well, you can pretty much be assured of a job.
So true.
So I just want to thank everyone for talking and giving their views on nutrition and the future for the pediatric GI world. I thank you so much, and have a good day.